All right, let's get more reaction now to the Health Minister being placed on special leave. Joined now by Mark Heywood, editor of Maverick Citizen. Of course, that's a section of the Daily Maverick. The Daily Maverick broke the story around digital vibes. So, Mark, this evening, what is your response to the fact that the Minister has been placed on special leave? Do you think it was the right thing to do?
Good evening, and thank you for having me. Yes, there's no doubt that it was the right thing to do. You know, we have to move beyond the era of impunity where people can ride out very serious allegations of corruption, particularly corruption of this sort involving 150 million rand that was meant to be communicating messages around COVID-19 and health that would save people's lives. So there's no getting away from accountability and responsibility. So I think it's progress. I think it's an important step forward. But I would say this evening that President Ramaphosa should be thinking about something as important, which is South Africa is in the midst this evening of a worsening COVID-19 crisis, again, with the third wave. Our health system has all but collapsed in certain provinces like the Eastern Cape. The stories that I'm hearing from there, Sally, are frightening of loss of life because of that broken healthcare system. So I'm afraid that replacing, even if temporarily, the Minister of Health with the Minister of Tourism is not going to meet the challenge that we face at this moment. And that's where I would be directing a lot of my concern at this moment.
Yeah, I mean, I was asking the question earlier on why the Deputy Minister, Joe Partler, can't stand in for him. And Dan Moyane actually got me an answer from someone who explained that you have to make a cabinet appointment. But nonetheless, this is a tourism minister who, my understanding is she's not a medically trained doctor. Doesn't matter though, Mark. You know, I mean, here's the thing. There's the DG, there are a lot of people. And actually what we see a lot of the time is we see inaction coming from our politicians.
Well, we have to hope that it does matter, because otherwise why have ministers? We need political leaders with portfolios like health who understand their portfolio, in this case health, epidemics, virology, medicine, who can lead from the front, who can rally the healthcare workers, who can inspire by the fact that they know what they are talking about. So it does matter. And I would say that it's quite likely that Minister Mkhize, on special leave now, may go from special leave to being suspended. We'll see what the SIU report says, but this may not be a matter of days or weeks. It may end up being a matter of months, and or may end up being permanent. And we need a serious plan B to deal with this emergency crisis. So even if it's not the titular figure of the minister, what is the plan at this moment to ensure that we deal with COVID and all the related aspects that it's presenting us with?
I mean, it couldn't have come at a worse time. You're flagging absolute crisis in the Eastern Cape. But even here in Johannesburg, the richest city in the country, we are seeing infrastructure failing us all the time, particularly in our hospitals. It is a very dire situation. What sort of gap is the health minister going to leave in terms of his leadership? You know, in many ways, through this pandemic, he was one of the voices that we trusted. There seemed to be open communication. He was honest when he didn't know where we were going with a pandemic that had all of us not knowing what was going on. Does he leave a big gap in the health ministry with his departure, particularly, as you say, as we're heading into our third wave?
Well, I believe that he does, because I think I agree with you that people have respected him, that he has shown gravitas, that he has shown seriousness, that he has shown that he understands the science, that he can engage with the top scientists in our country. And for all of those good reasons, he has won respect. And therefore, it has to be said that it's a tragedy when politicians who show leadership in certain key aspects of their portfolio cannot lead when it comes to questions of corruption and good governance. My worry, again, is that the leadership of the National Department of Health, the provinces, is really paper thin. The national department has a serious skills deficit. I don't know why Dr. Joe Patla has been so invisible throughout this epidemic, because he's a credible person who knows medicine, who is a doctor, who's respected within the medical community. The DG, we haven't seen the DG since he was appointed nearly 2 years ago of the department. And to be honest with you, I feel as if quite a number of the MECs are not fit for the posts that they offer. So it's precisely this fact that there's a paucity, that there's a shallowness of leadership. And perhaps, ironically, that's why we hang on so desperately to the one or two people who actually show that they know what they're talking about.
Yeah, absolutely. I have to say that I have interviewed Anban Pillay, the DG, fairly recently, and it does seem like he's trying his best to hold things together. But Mark, I have to ask you about the vaccine concern. We are waiting for the FDA to clear those J&J concerning batches. But already we know that vaccination is slowing down because we are running out of stock. Mark, can you hear me still?
Yes, I can hear you. You came back. I lost you for a minute.
All right. No, I was just talking about the vaccine stock and the fact that the J&J stock has not been cleared. I don't really know what to say at this point, because it seems out of our hands, unless, of course, South Africa goes rogue, which could lead to all sorts of problems if we act without the FDA approval, surely.
Well, we can't act without the FDA approval. The consequences are too grave. I wish the FDA would wake up and recognize the crisis that we are facing. From what I hear from Johnson & Johnson, from senior executives there, there's never been a question of the vaccine batches that have been developed in South Africa being contaminated, or any cross-contamination from the plant in the United States. So you can understand that they have to be thorough about their audit, but they also have to understand that lives are at stake. And at this moment, we need those million-plus vaccines like we need nothing else, because they're easier to administer, they're single dose, etc. So again, yes, the anxiety, the sense of desperation and the urgency are all warranted.
And Mark, thank you so much for talking to us this evening. Such a worrying time for our country. That was Mark Heywood, editor of Maverick Citizen, which of course is a section of the Daily Maverick.